Are you interested in gaining greater access to essential healthcare services? Keep listening to hear how elected officials and state pharmacy leaders are making pharmacist primary care a reality and how you can help.
Hi pharmacists and friends, today is Friday, February 2nd, 2024. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen in to find out how pharmacists and pharmacy students like me can improve population health, health equity, and patient care through advocacy and education. My name is Cassie Capezza, and I'm a final year pharmacy student at the University of Rhode Island working with the Rhode Island Department of Health alongside my professor, Dr. Bratberg.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the URI College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
Today we plan on discussing some recent Rhode Island legislation as it relates to pharmacy and some topics that have been or will be introduced this upcoming legislative session. We're excited to have our special guests, Dr. Federico and Senator Meghan Kallman.
Yes, welcome back, Dr. Federico, or Chris, and Senator Kallman. Thank you so much for being here. Why don't you guys introduce yourselves? We'll start with Senator Kallman.
Thank you so much for having me. I'm Meghan Kallman. I represent District 15, which is Pawtucket and Providence.
And Chris Federico. I'm the current president of the Rhode Island Pharmacists Association, and thanks for having me back.
This is the second episode of the season where we talk about policy. We started with discussing overall efforts to draft bills and gather support with my friend and policy expert, Andrea, a few weeks ago. Senator Kallman, from your perspective, what would you say are the key components to successfully passing legislation?
That's a great question, and I think it depends a little bit on how well-known your topic is or the subject is, right? So there are some issues where the public has like a high degree of fluency in it, and so it requires less public education, less education of the legislators ourselves. And there are other issues where you really have to explain the significance. And so something like the hormonal contraceptive bill, which we'll talk about in depth today, that was somewhere in the middle, right? I think certainly I, as a person with a body, understands what hormonal contraception is, and I understand its significance, right? I've, been a strong advocate for self-determination and physical determination and, endorsed by Planned Parenthood and that kind of thing over the course of years now. But why the pharmacist could play a more active role in expanding access to healthcare was something that I, sort of was intuitively understood a little bit, but needed to be educated on. And so to that extent, that was really helpful for me. But as far as the coalition and sort of the process goes, legislators legislate on things that we understand, right? And so when there's an issue like this that requires a little bit more education, we had a group of pharmacy students actually who were in the State House. They were meeting with people. I had many conversations with Dr. Federico over the course of the session, both about what the bill should include, how we engage our co-sponsors, but then just sort of consistently advocating for things over the course of the session. I think one of the sort of big misunderstandings about the ways that bills operate is their sense that like you go to a hearing and you show up and you testify and then it's done. That's the beginning, right? In Rhode Island, most bills that are heard are then held for further study, and that's kind of an interesting term, but it basically means like the committee takes a look at it. So if you are a student, for instance, like I advise grad students in my other life, when they give you your first draft of a master's thesis or something, it's not like I just accept it, right? We go through revisions, and so the same is true of bills. And so when a bill is held for further study, it often means that it needs some revisions, right? We're going to change this proposal, we have to change that proposal, we have to change the effective date. There's a group that wanted, us to consider X. So it's that the deliberation is not necessarily happening like in the committees in front of the audience, right? There's a process by which legislators and advocates are trying to figure out what needs to change. So the hearing process usually starts as an information gathering process, right? So when I sponsor a bill and I go in and I present the bill and then we hear from the public, oftentimes I know what the public is going to say, but every so often, someone will show up to testify on a bill that I, don't know, and they give me some new information and we take that back to our colleagues and work on it. So I guess I would say some of that is education and some of it is advocacy, but really the trick, especially in Rhode Island because of how we work, is that your advocacy is sustained over the course of the session.
Yeah, thanks for that. I think it's important to show that policymakers are humans and not experts in the many, many things that all the committees you serve on. And, we always say it takes years to pass a bill, because you can't also just say, just like a student here, I can't say, Cassie, here's this thing, and you've learned it, and expect you to know it forever. You've got to, repeat the education. We're going to switch over to Chris, but I have to say that I've been working with Chris for years, advocating for and attempting to pass legislation. But his leadership last year was recognized by the American Pharmacists Association at their annual meeting next month for the 2024 Good Government Pharmacist of the Year, or the GG Cody, as we call it. Congrats, and I was proud to nominate you, and Senator Kallman had graciously offered a very positive letter of support for this honor. So not just everybody wins this award. What do you have to say, or what have you learned in all the years that we've been trying to pass bills? Why were we so successful? What are the ingredients to that success?
Sure. So I think one thing that we learned from prior years is that really the work starts well before the session happens, and taking more of a proactive approach. So prior years, I feel like whenever we had legislative meetings, we would essentially just look at the bill that was submitted, we'd make suggestions, we'd go to testimony, we'd write letters. I don't think we really had much of a personal connection with many of the legislators. Maybe we did with the bill sponsors, but not much more than that. So that was something the past few years I've really dedicated to, not only knowing the causes that each legislator has that relates to our bills, but what else they're working on, because I think we need to make sure that we can show support in other areas, and that's really how you gain their trust and support in the long run. So after the bill was submitted the prior year, the Senate sponsor that held a contraception bill actually did not run for re-election, and Senator Kallman took over the bill, and we connected. I don't know when it was, but it was several months earlier. I also connected with the Rhode Island Coalition of Reproductive Freedom that we've talked about, so Nicole Jelinek, and then Beth Cronin from ACOG, Dr. Beth Cronin from ACOG. She's the president of the local chapter. So we all sat down, we had a lot of discussions, back and forth emails, and we really wanted to make sure that the bill passed this year and had a solid version, and made sure that the key ingredients that we were looking for really were present. And Jeff, as you know, I've always been pretty adamant about making sure that we have payment for services in anything that we introduce or pass. And so that was something that we really held our stronghold on this year, and made sure that everything that we wanted was included. Obviously, you have to make concessions, but I think that's important. So making the personal connections, starting early, and being persistent. I think, like Senator Kallman said, we talked many times, and I don't know how many times or hours that we talked, but we certainly had many, many discussions about who to engage with, how to approach certain situations. And it just took a lot of work, and probably a lot more than we thought it would be. But I think in the end it was successful, and we're happy about that.
I'm pretty sure you texted me from the top of the Eiffel Tower about this.
I did, yeah. So I think many people probably know that I run marathons and have done it, internationally. And so I was trying to check on the status of the bill and see what I could do, and I was away for over a week. So I just was checking in, and because I couldn't come and meet, and I had cell phone service, and I think I texted you, and you said, "Oh, you have service up there." I was like, "Well, it is the largest radio antenna that's in the country right now." So, but that's true.
That definitely is the definition of persistence. When you're up there to
it's a night and day job, I think, if you want something to go through and be successful.
Yep, and I think that piece of it is, a part-time legislature has some features to it that are unique. Some that are, better, and some that are worse than a full-time legislature. But so Rhode Island's legislature is part-time. We meet 6 months a year about for 3 to 4 days a week, depending on your committees. We start around 2:30 in the afternoon and stay some days until very late at night. And this is designed in theory so that, we don't get paid very much, not enough to live on, right? It's a little stipend. And so everybody has to have another job, including me. And so it becomes like a pretty demanding thing time-wise, and it's the nature of the beast, right? There's some challenges with that I think have effects on the way that democracy is experienced, and those are things that I'm interested in looking to modify. But at the moment right now, if we're giving advice on how to be effective, we have to advocacy has to happen in the evenings. And that can be really challenging for people who have caregiving responsibilities. It can be challenging for people who have classes or work in the evenings. And so building coalitions of folks who can tag team the different days of the week and the different sort of jobs can be important and helpful, because the reality is that unless there are some flexibility to attend events, meet people, attend hearings, come to meetings, all of that kind of stuff, bills stand less of a good chance of moving.
And I think one more thing is that we really recognized was, we had worked very diligently on this for several years, but we also had a great advocate that I'm sitting next to right now that would then go have me talk to someone else about the issue, go talk to someone in leadership. And sometimes that warm handoff really made the biggest difference in the world, because otherwise you're cold emailing, you're trying to go approach someone that's running in between meetings and trying to catch them. So the warm handoff and that interpersonal connection really makes a huge difference. And I was very appreciative of it. And that's, I think, most of our bills that passed were because of those reasons.
Yeah.
So I wanted to talk about some specific legislation. Last year, pharmacists added prescriptive authority to their scope of practice through state legislation and are now able to prescribe hormonal contraception and HIV pre- and post-exposure prophylaxis, also known as PrEP and PEP. Regulations are pending approval before full implementation later this year. While it's great that pharmacists can prescribe some essential public health medications, it's important that pharmacists are paid in order to be able to implement these new services. For example, having pharmacists be able to bill insurance so there is funding to pay a pharmacist to meet with patients while maintaining all of their other pharmacy operations they have. The hormonal contraception bill doesn't exclude this in the text, although it's not part of the HIV PrEP and PEP bill. Senator Kallman, you worked on Bill S-0103 regarding hormonal contraception and made sure that the payment was part of that bill. Why was this bill so important to you and your constituents, and why was payment so critical to be included? Why is it so difficult to pass a bill?
I think there's two components to this question. The first is that is the reason for doing it, right? And the second is the payment piece. And one is a kind of out in front issue, and the other is a kind of under the hood issue, right? And I'm going to let Chris talk a little bit more about the payment and why it matters. Obviously, for me, payment is what enables our organizations to do their jobs. And as we have seen, when the state has low reimbursement rates for things like mental health, for instance, therapists, social workers, we wind up with a real shortage of people who we need, right? So payment is important. We live in a society with money. However we feel about that, that is the reality. And if we don't pay people, living or sustaining wages, then the things that we want them to do are imperiled. As far as why I picked the bill up and why it was actually brought to me by a primary care physician in my district. I was knocking doors and she said, "What do you know about this bill?" And I said, "I signed on last year, but my understanding is that the prime sponsor has chosen not to run for re-election and blah, blah, blah." And she said, "Well, would you take it?" And I said, "Sure." And so I picked it up, one, because reproductive autonomy is one of my very core values, and that this is a thing that expands it, right? We've all seen what has happened in the country since the overturn of Roe, and there are aggressive attempts on behalf of a lot of different institutions to restrict people's autonomy. And so for me, any way that people can have more control and less judgment about what they choose to do with their reproductive lives. In fact, I just wrote a whole book about it.
What's the name of that book?
The book is called The Conceivable Future: Planning, Families, and Taking Action in the Age of Climate Change. But for me, anything that I can do to help people have as much autonomy, as little judgment, and as easily accessible healthcare services, particularly reproductive healthcare services, is something I'm interested in doing. I will say, though, that I'm a trained sociologist, not a trained pharmacist, and so having a partnership with Chris, who could help me understand some of the things about the profession in general and like the way that reimbursement works for pharmacists, like that's new material for me, right? I understand on an intuitive level why this bill is important and why it expands healthcare access. What I didn't know very much about was how billing works. And so for that, I rely on my partners in the advocacy community for all bills, but for something like this particularly.
And I think what's interesting is that it's a two-way street, right? Once you know about something, then you can reach out to other folks. But then once pharmacists and those listening, if you form those relationships with lawmakers, they're going to come to you. I just had Senator Whitehouse's office email me about something. I'm an OUD expert, and I introduced myself. And they're like, "Should the senator sign on to this letter?" And I'm like, "Yes, thank you for reaching out to me." But if I hadn't reached out to his policy person, they never would have thought, "Hey, let's get a quick read from this expert." So I think I do a lot of the stuff with the federal government and, of course, the state government. We need to work hand in hand so that, it's part-time governance, that we can get all this stuff done. So, Chris, you mentioned a few solutions: the personal relationships, the persistence, working before the session starts. What other things? I know that you basically lived at the State House, and I was there very late with you last night, and then we came to our current location.
Not last night.
Not last night.
End of the session.
The end of the session. Sorry.
Don't add one more night.
The last night.
Yeah.
But again, I guess where did you get the idea? Either from your other parts of your job or your life or your jobs, multiple jobs. Where did you learn that last year? Like, what were the key ingredients? How did it all come together so that these bills would be passed?
Yeah, I think the first thing is, Cassie, can you make sure you put the book name in the chat, in the link in the bio?
What's that book name again?
It's The Conceivable Future. So I think make sure we put that in the comments of the podcast. But back to the reimbursement piece, one of the big things that we focused on, not only with Senator Kallman and also on the House side, but also on the coalition side, is looking at the bill really in depth and what it really is intended to do. So we were looking at the intention of the bill was to expand healthcare access. So if we looked at how it was written and we look at some of the other states that have implemented this expansion of pharmacy services, the states that actually said, we'll worry about the reimbursement or the payment really afterwards, many of those states actually, it came back and they said, that we're not doing this. No one is doing this in the state because essentially they have no reason to, right? If you think of an independent pharmacy or even a chain pharmacy, why are they going to have a pharmacist pull away from their normal responsibilities to go do this 3, 4, 5, 8 hours a day? Where is that extra resource going to come from, whether it's financial or whether it's an extra person in the pharmacy? So when we looked at the bill, it actually said that you must be an in-network provider to do this. Now, actually, in Rhode Island, pharmacists were considered out-of-network providers. So when it said it excluded out-of-network providers, that meant pharmacists, once this passed, would not be paid for services. So we really fought hard to make sure that was understood, that was actually an area that we did not agree with, and that other states that actually worked on this later actually did not even really use this service to the extent that other ones that did have payment included. So, we're thinking...
Sorry to interrupt, but that, we base a lot of our testimony on Oregon that saved Medicaid
$1.6 million.
$1.6 million. Yep. And I was just talking to our colleagues in other New England states who've recently passed hormonal contraception, but they're not going to have any uptake because they don't have payment. That's direct from the source.
And one of the things that I always thought of is, what if someone came back to us in a few years, 3, 4, 5 years, and said, hey, I thought this was going to be something that really expanded access to contraception, and it's 10 years later and really no one has done it. It's because we didn't have the support for pharmacists to do this. And especially if you're an independent pharmacy owner or a independent pharmacy practitioner, that is something that'd be very challenging for someone to accomplish day to day. And so you wanted me to talk about how I lived at the State House, right?
A little bit, yeah.
So I think it was really after,
define persistence.
Yeah, I think, it really came down to, when we didn't hear anything that was going on or trying to uncover what was the gap, what was the misunderstanding, what was the lag and, the delay in things being actually heard, whether it was in actually the committee or being brought to the floor. So that was just me trying to get a hold of people. And, you have to meet people where they are. And that's where they are, is at the State House.
And not the committees that Senator Kallman talked about.
Right.
We in the past, I was just as a history lesson, we would work with all the people involved and we'd go say hi and we'd have, 10 students in white coats, talk about how important this is. And now we've learned you only need a couple people. You've got to work beyond that hearing when it's held for study and be the educational aspect for it.
And I think in the final days and the final push, I would just go ask, people in leadership or in committees and say, what do you need? Do you need more letters? Do you need a certain thing clarified? And, actually for this bill, we don't need more. We need less. We actually need to have a single or a couple voices, and that's it. And just, if we have questions, we know where to reach.
And I just want Senator Kallman to talk about leadership, because I don't know if people understand the importance of leadership of committees and the Senate and the House. Do you want to comment on how important it is to talk to those folks?
Absolutely. A chair of a committee is a person that is responsible for, working the policy through that committee. And so, all of us who carry bills, we do it ourselves, but any bill that I want to pass, I work with the chair of the committee to which it is assigned, right? So I have a bill, for instance, that would ban PFAS, which are, forever chemicals. And I'm working very closely with the chair of the Environment Committee in order to do that. So it's important for, people to hear that matters, but ultimately, the chairs are, participating in the process of negotiating with the other chamber, and they're collating the feedback that they're getting from other committee members if there's disagreement within the committee, right? Like that is, it's sort of a teacherly role there's a leadership component to that. And so, if there's no feedback on a bill, positive or negative, then it seems like, chairs will often perceive that there's not that much interest in it. And so connecting with the chairs and, making sure that they really understand the issue is part of it.
So House Bill 7273 was newly introduced and states how all services provided by pharmacists should be covered if those same services are covered when provided by a physician, advanced practice nurse, or a physician assistant. It also states that the health plan should be required to provide an adequate number of pharmacists in the network of participating medical providers. Senator Kallman, why should this be passed and why would it be effective?
Presumably if Chris is providing a service and if you are providing a service, even if you have different credentials, if you are both reasonably credentialed, you should both be compensated. Right, like if we want services, we need to pay for them. And I that's a no-brainer. We talk about expanding prescriptive authority. That is going to come with reimbursement questions. But again, if the goal is to get more people access to healthcare, then that's gonna mean we have to engage questions of reimbursement.
Senator Kallman, I have one last question for you. Did you learn anything specifically from pharmacy-associated legislation last year that should be kept in mind for the future?
I think working on this bill has taught me about the pharmacy, sort of the practice of pharmacy in a way that I was not familiar with before, right? That's one of the actual real gifts of a job like this, is that you learn all sorts of stuff. About fields that I don't know anything about and places I don't work in. And as issues come to me through the community, as this one did, and people say, hey, look, we really need to do this, then I have the ability to learn something and problem solve. And so there's a real richness there. And I look forward to being able to use that knowledge again to expand healthcare access as we go forward with this and other bills this session.
There's currently a large primary care provider shortage nationally, which is also a pertinent issue in Rhode Island, mentioned by several legislative leaders. Pharmacists are medication experts and already practice in formal and informal collaborations with providers in primary care settings. Chris, you're someone who has worked in an ambulatory care setting and would be able to envision how pharmacists can implement these services into their practice. Why would prescriptive authority and provider status for pharmacists be so beneficial in a healthcare setting?
So one thing that's really come to the public view recently is the primary care shortage that you alluded to. And I have to say, one thing that URI has done a really good job, or URI Pharmacy has done, we've really put how pharmacists can help this into the public sphere. So we've seen Dean Carey LaPlante talk about it. We've seen Dr. Ginger LeMay talk about it. Myself has been quoted, and other people within different institutions. And it comes down to not replacing primary care. It's really to supplement them. It's really to help the gaps that exist, help bridge that gap to get people into the healthcare system that aren't really having the access that they desire at the moment. So right now, I'll give you a perfect example, is what the 195 bridge is currently, it's not closed, but it's basically, at a standstill most hours of the day. And so someone that lives on one part of the state and trying to get into the city or vice versa, they might wait 1-2 hours just in a single direction. So what if they had a service that was at a local community pharmacy and they were actually able to go to their pharmacy, talk about smoking cessation, get started on a therapy, get started on hormonal contraception, discuss diabetes care, whatever you have, instead of waiting 1 or 2 hours in the day. Because at the end of the day, what people do is they just don't do it. If they don't have the time, they can't fit it in, they just avoid it. And they say, I'll do it tomorrow, I'll push it back, it's not a priority. So since we know that pharmacies are, that's 90% of the population are within 5 miles, we know that people can get somewhere and get somewhere pretty effectively. So I think where it comes down to supplementing the primary care shortage is we can help those services, that low-hanging fruit, help identify those patients, and then essentially when they actually come to us, we can determine if they actually should get follow-up care from a specialist, from a primary care physician that they're currently not seeing. The example I give a lot of times is if someone comes in for smoking cessation, and we talk to them and counsel them, and we say, hey, yeah, I think you're ready to go on either Chantix or a tobacco cessation product like a patch or whatever. And we find out that they've been smoking for 35 years and they haven't seen a doctor in 5 or 6 years. Have they ever had screening for lung cancer? Now, we're certainly not going to do that, but we can say, we really think it's important that you go see someone and have this discussion, because it sounds like you probably need to get some sort of workup, whether it's a low-dose CT or something, whatever they determine is necessary. But that's an example how we can capture someone in the general public and then refer them back to an appropriate clinician. I think when it comes back to reimbursement, where I used to work, I worked in a collaborative practice setting, which means that the physicians or even advanced practitioners could delegate that responsibility of me, treating and deciding on medications for someone with diabetes or whatever condition was signed off in that agreement. And how it stood was we actually provided those services for free because we couldn't bill. So many times, many of these organizations, they decide that, they're not going to hire a pharmacist or someone else because we can't bill, so they'll hire someone else. That person gets used for sick visits, or that person gets used for other ancillary services, when the things that we probably need for whether it's quality measures or just for really high frequency, high touch appointments could be delivered by a pharmacist that we've been seeing all across the country. So if we're able to receive payment, that could go into the overall organization, and the overall organization can build the infrastructures needed to really support patient care more effectively.
And then, in addition to House Bill 7273, another bill regarding pharmacists prescribing of tobacco cessation medications, including nicotine replacement therapy, is planning on being reintroduced this session. Chris, you've been very involved with the Rhode Island Department of Health and American Lung Association team that has crafted and introduced this bill. How likely is it to be passed this year?
Well, I'm going to say 92.75%. I don't really have a percentage, but last year was the first year that it actually passed an entire chamber, so it actually passed the entire House. So this was a bill that's been worked on for many years. Dr. Anita Jacobson from URI, she was one of the forces behind this for several years. It's been going on. I don't know, Jeff, do you know how long this bill has been?
Long time, many years.
Yeah, so Senator Bridget Valverde has it on the Senate side, and then on the House side we have Rep. Teresa Tanzi. So they've worked with me for a long time, and we've really looked at the bill very closely and tried to make amendments accordingly. So, for example, a couple of years ago, no one wanted to have Chantix in there, so that was actually an educational point of, just going back to the Eagle study, why Chantix wasn't as much of a concern as we used to think. So we really worked on the language, we worked on the payment. There's just a number of things that really took a lot of time. So we're very confident that it's going to go through the House. I think last year there was so much positivity and so many good bills that passed on the pharmacy side that unfortunately it probably wasn't one of the highest priorities for some reason. And I think it's just something that, this year it's got a little bit more vision, among the leadership and among the rest of the chambers. One thing that we did do, I would say, with the contraception bill is Senator Kallman actually got us to write an op-ed in the Boston Globe. So I think this year we're going to pursue doing a little bit more not publications, but really a little bit more writing to bring awareness and make sure that people actually see the true importance of it. When it comes back to, and why are we doing this if we're going to do the overall payment? Well, pharmacists need to have the service, being able to deliver that service first. So we want to take the payment bill, and the payment bill is going to allow the infrastructure in the background, and then we can kind of talk about all these different services that we feel are effective for pharmacists to deliver. So we can kind of take them, really parallel and hopefully drive it home this year. Another thing that is a key to success is not making the assumption that what's going on in one chamber actually correlates into the other chamber. Many times there's different barriers that exist within leadership, or there's different barriers that exist within the bill sponsors, and where the person, at the pharmacy association level, what I was trying to do was bridge those differences and bridge those relationships and make sure that one side needed to know what the other side was doing. And I think as the session really starts to get going in full force, people just get really busy, and they really don't mind that you help remind them of some of the key objectives or some of the changes that are going on. Because if there's a change that one of the other legislators or one of the bill sponsors disagrees with, they really want to know, and we can really attack that more proactively. So that's another key to success.
Yeah, it sounds like a lot of exciting things happening. Looks like we've learned our lessons and applying them, and that's sort of the goal of this. Chris, what do you think would be the regimen for passing these bills, the provider status, smoking cessation, improvements to other services we're providing? What do you think is the regimen? What can people do?
I think there's probably 3 to 4 things. I think the first thing we talked about was being persistent and starting early. So engaging with those people that you have established relationships with, knowing which person to seek out for help, as we alluded to prior. I think the second part is, as Senator Kallman said, it does not stop at testimony. And it really, you need to engage all the different allies, whether it's the Lung Association, whether it's different coalitions, working cross partnerships. And then the third thing really is anticipating challenges. So anticipating who the people that might be opposed to it and collaborating with them, reaching out to them and collaborating with them, making sure that the medical societies know that this is not a bill. These bills aren't to replace you. These bills are to help expand the services that you can get from getting additional time, getting patients referred to you, having a support system. So, collaborative practice, we're embedded in the office, and that's great. But most pharmacists in the state, especially this state, are not doing that. Now, those pharmacists are really working effectively and working at the top of their license. You look at companies like Coastal Medical and Rhode Island Primary Care doing awesome things, but they're not everywhere. So we need to help educate and deliver those opportunities to our colleagues, in the entire state.
I'm very glad that we got to continue our discussion today about pharmacy legislation, and I think we had a great conversation with our incredible guests, Senator Meghan Kallman and Dr. Chris Federico. Thank you for joining us today and giving your great expertise and insight throughout our discussion.
Be sure to follow us on our socials at PharmD Pub Health and Rhode Island Pharmacist. Is it at RI Pharmacist?
Yeah, it's RI_pharmacist because it looks like RIP, which does not look good. So we're RI_
frown upon death.
Yes, frown upon death. I think that's Dr. Dufresne. So RI_pharmacist, and if you follow us on Twitter, we're RI Pharmacist, and we're also on Facebook.
And we'll capture all that again at PharmD Pub Health is the Instagram, LinkedIn, and Twitter handle that we use for all of our podcasts here. We're also on Spotify, Amazon Music, Apple Podcasts, wherever you get podcasts. Smash that subscribe button and make sure you get post notifications and tell a friend. Thanks for listening.